How does the AV foot pump treat diabetic foot? Once a diabetic patient suffers from foot ulcers, there is high risk of long-term unhealed ulcers or even amputation. And unfortunately, some patients will die. Because of these facts, we pay much more attention to the diabetic foot than before. In fact, the major reason of diabetic foot is lower extremity arterial insufficiency. In contrast, the AV foot pump increases blood supply to change arterial insufficiency. Thus patients can avoid various vicious incidents by using the AV foot pump. How does the AV foot pump achieve this? 1. Significantly increases arterial blood flow velocity. 2. Establishes collateral circulation. After 30 minutes of using the AV foot pump, the duplex ultrasound detects a significant change of popliteal arterial blood. Systolic period, blood velocity increase, from the 19.5 cm per second before use, to 30.3 cm per second after 30 minutes of use, an increase of 55.38%. Flow increases, from 173.5 ml per second before use to 265.7 ml per second after use, an increase of 53.1%. Diastolic period, from 5.4 cm per second before use, to 11.5 cm per second after use, an increase of 113%. Flow increases from 46.6 ml per second to 98.1 ml per second, an increase of 110%. Studies demonstrate that the significantly increased arterial blood supply is attributed to augmentation of arteriovenous pressure gradient made by AV foot pump. What is arteriovenous pressure gradient? It is the pressure difference in microcirculation between arteries and veins. The larger the arteriovenous pressure gradient, the stronger the arterial tissue perfusion, and the more nutrition and oxygen will be obtained by the surrounding tissue. On the contrary, if the arteriovenous pressure gradient is low or near zero, it indicates that tissue cannot get enough blood supply. This causes ischemic unhealed ulceration and necrosis. Because the lower extremity atherosclerosis of diabetic patients is progressive, the lumen of arterial vessels gets narrower and narrower. Following these pathological changes, the arterial pressure of microcirculation will reduce. Its gradient and its arterial tissue perfusion ability also reduce, leading to a worsened ischemic condition. With the extent of ischemic limb development, the condition gradually changes from an initial cool feeling and numb, to claudication, and finally necrosis and amputation. By accelerating venous return, the AV foot pump reduces the venous pressure to compensate for the decreased arterial pressure, causing the arteriovenous pressure gradient to increase. Because of a greater arteriovenous pressure gradient, better arterial perfusion comes and ischemia limb is improved. As a metaphor, imagine a series of small streams gradually getting closer, until they join and form a great big reservoir. It is commendable that the AV foot pumps not only increase arterial blood whilst being used, but also help ischemic limbs to set up collateral circulation to get a permanent cure to some degree. Clinical studies have shown that if long-term use is strictly followed, the AV foot pump can effectively stimulate ischemic limbs to establish collateral circulation, which is the same as building new roads to remedy traffic jams. Because using AV foot pumps is equivalent to walking, it encourages natural stimulation of the generation of collateral circulation. The following research data fully proves this point. Figure 1 and Figure 2 show that the index reflects the walking ability of patients, initial claudication distance and absolute claudication distance in patients with the use of 4.5 months, respectively, increased by 146% and 106%. Figures 3 and 4 show that, reflecting lower limb blood supply indicators of natural ankle brachial index after exercise and the popliteal artery flow in the use of 4.5 months, respectively increased by 110% and 36%. For diabetic foot patients, when it is best to use a foot pump, please read the following medical information, because of the body's powerful compensation ability. Even if 30% of blood lumen is blocked, patients don't show any symptoms. When the blockage is between 40 to 50%, lower limbs began to feel cold and numb. At 70%, patients develop intermittent claudication. At 90%, the patient experiences pain and unhealed ulcers appear. Visible symptoms of the patient's self-perception lags far behind the actual lesion degree of blockage of blood vessels. However, because most diabetic patients are elderly, they think that the cool, numb, claudication leg strapped phenomenon is normal for old age. They don't pay attention to it until they tend to see skin ulceration after ignoring unhealed ulcers. By then it is too late for some patients. Therefore, as soon as symptoms appear, hemp should be applied as soon as possible, and patients should strictly adhere to daily use of not less than 4 hours in order to reverse and hinder the development of limb ischemia and avoid the occurrence of ulceration and amputation. And even if the symptoms improve and disappear, it should be used for life. After all, diabetes and vascular atherosclerosis will accompany the elderly throughout the aging process. Beside the AV foot pump, is the heart of good assistant.